We'll be talking about a type of dermatological illness that usually manifest in a very uh, superficial manner, and these manifestations are known as warts. So, warts are a type of skin infections that are usually caused by a type of virus that is known as HPV virus. HPV virus is human papillomavirus. The human papillomavirus have a tendency to create uh, different types of manifestations on skin, maybe on a subcutaneous portion, or you can see on the uppermost portion of the epithelial layer surrounding the skin. The most common warts are found in children's and also in some categories of adults. Okay, the primary reason for getting warts is being infected with objects containing the virus, or shaking hands or having any intimate contact with the person having the active infection. The most common mode of transmission of human papilloma virus causing warts is shaking hands, using toilets and bathroom that have the viral content of the wart, and another reason may be due to some defect in the genes that cannot upregulate or downgrade the regulation of immune response cells, hence leading to the overproduction of cytokines, and these cytokines in turn deplete the immune environment, leading to more and more production of viral genes that are causing HPV infection. Maybe the virus was initially in a dormant state, but due to immunosuppression, the virus got reactivated. The same happens in the case of herpes group of virus infections. You can say herpes simplex virus or herpes zoster virus. The same, but with the different manifestations and different type of textures of framing the infections on the skin. So, if we talk about the main uh, type of manifestation seen in human papillomavirus infection, may be the common presentation of warts. Usually, there are more than 200 varieties of human papillomavirus, of which we can say 50 to 60% of the viruses known to us or are not just uh, so much prevalent in Asian nations, but the widespread concern is seen in European nations. The reason may be due to the deficiency of vitamin D and folic acid in the blood serum of the patient. From the research point of view, we have seen that the people having HPV infections have very low serum amount in median percentage calculated over a different interval when the patient was suffering from severe terminal illnesses. Although HPV can occur as a secondary illness if the person is already having serious issues with them. Another reason may be due to the transmission of the infection from the patient to the healthy person, maybe knowingly or unknowingly. Now we can talk about a little bit about the texture of the warts. On the surface level, warts are very much of grainy nature. They can be round, they can be spherical, they can be of flat, remorse ecotexture. Then they can have somewhat like decaying natures also. So, according to the strain of the virus, the presentation is usually seen to be typical as well as atypical. So the most common form of wart that we can assume to have in a normal person may be like a common wart. Some research suggests that the reason for the progression of warts is the insulin resistivity, or you can say insulin insensitivity. The rapid spike in the insulin during the fasting stage is the reason in the obese person. That is the reason for the production of more and more warts on the superficial region. Most probably the reason is on the below portion of the neck, or on, you can say that the anterior portion of the neck. It can occur any parts of the body, usually the intimate parts, or you can say intimate areas where the infection is. The suspicion is usually made due to the sexual contact, or direct or indirect contact, either with the oral, or you can say penetration level contact. These type of viruses that cause warts in the intimate areas of human can lead to malignancies. In case of women having these types of virus or viral load in their body, the chances are, fair chances are there that the female patient can get cervical cancer or other uterine cancer that are linked with this type of strain of human papillomavirus. Usually the strain 16, 17, 33, 41, 52, 60 are the major factors for the malignancies. Somewhat like factor HPV 1, 2, and 7 are less likely to cause a tumor that could be metastasizing into a severe life-threatening cancer, or you can say severe carcinogenesis in the cells. Unfortunately, we don't have any proper medications for this disease, but the hopeful treatment lies for the common warts, or the mosaic warts, or the callus caused by the warts. But although the patient needs to have a lot of patience during the treatment, apart for the common wart is concerned, the treatment would be 3 months supplementation of zinc and zinc products in the diet, either in a dietary form or in as a supplement form. That must be taken for 3 months. Then you can use salicylic acid topical application that would clean the wart up to 90% in the cases if the patient consistently applies it on it. Due to the manifestation, it could give anxiety and depression to the patient who is suffering it for the first time. Since it is a viral infection and the coexistence of the virus on the different parts of the body is still a risk, or you can say a matter of concern. Although the common warts are non-malignant in nature, and those wart doesn't cause any harm to the body or any particular harm to the body, but still the stigma of having HPV infections lies subconsciously in the mind of the patient. So if you talk about the histopathology of the warts, we will see a circular diminishing changes in the apical portion of the cells, and you can see beside the epithelial cells.
Bluetooth waiting for connection.
And you can see that the hollowness in the immunofluorescent imaging suggests that the large bodies of viral loads are made, and the keratogenesis is happening in that area. Since the viral nature of the HPV infection is such that they produce a lot of keratins, a lot of keratins inside the cell. These keratin with the course of time becomes hardened and makes the area somewhat like a cauliflower like texture, where there will be granularity, rough texture, and the wart seems to be like hard in nature. Unfortunately, it should never be touched or scratched, as it can contain the virus and it could also mean to spread the infection to different parts of the body. So zinc could be a very good medicine, or you can say supplement, for preventing HPV infection for further replicating it into the body. Although with the research data, we can conclude that the two-thirds of the adult population suffering from this warts can get ease after 3 to 4 years of the initial infection. Now, what are the alternatives of the treatment of common warts, or even those complicated warts? The first is fine needle incision, and then we have electrosurgery curettage, and then we have radio ablation to kill the dead virus. Now we have also one another type of treatment, that is nitrogen, liquid nitrogen cryotherapy. Okay, in that process also the warts are being freeze at the temperature minus 186 degree Fahrenheit, and consequently these warts break down and shatters into the pieces, and after 15 to 20 days the new cells generate on the infected areas, and treatment is good. Overall, the prognosis is well better in terms of common warts, but if you want to get rid of the illness, you should have the proper supplementation of zinc, folic acid, vitamin C, and all the trace minerals that are helpful in preventing the immune breakdown due to the presence of a lot of viral pathogens. Another reason for getting the rapid viral infections related to the skin may be the reason due to the autoimmune diseases. Many autoimmune diseases just changes the nature of proliferation of the gene to the certain levels of protein encoding in the cellular DNA. In that context, immunologically, if you see that the altered response creates a lot of cytokinesis and lot of inflammatory immediates into the immune environment that could induce different types of infection in the body. So it's better to keep a regular check of the immunity and the oncogene cells, or you can say, if you really want to get satisfied with the immune system working, you can have various immunological tests and some sort of screening for these types of illnesses. Usually HPV testing is done for females, and the HPV vaccine is prevalently used in US and Canada. Female of age 14 to 28 can usually get vaccinated once, and US FDA as well as WHO also says the data of vaccinated females, those who are having HPV or have recovered after having the vaccination of the HPV infections. So this is all for now. Thanks for watching the video. Have a nice day. Thank you.